Hello friends, welcome back to my channel. In today's video, we will be discussing about vitamin B3 or niacin. In our previous video, we had discussed about vitamin B1 and vitamin B2 in our vitamin series. So, in today's video, we will be discussing the vitamin in under these headings which I have written here, and these are the common headings under which we usually describe all the vitamins. And this vitamin B3 is usually asked as a short note. Coming to first the synonym, it is also known as nicotinic acid or pellagra preventing factor of Goldberger. And one thing I have tried to cover, I have made these notes covering all 5 to 6 important books which we usually refer to. So I don't think you need for anything other than this. If you go through all complete video and go through these notes, it will be more than sufficient for you, and all the topics, all the points from different books will get covered by you. Now coming to the structure or chemistry, it is a pyridine. This vitamin consists of a pyridine ring with a carboxylic group attached at the third position. So the structure is pyridine 3 carboxylic acid. But the active form, as we know that all the vitamins are present in an inactive form and an active form. So the active form is nicotinamide, or in some books it is written as niacinamide. So here what happens, in place of carboxylic group, a amino group NH2 group is present at the third position. So it is nicotinamide. Now the coenzyme form of the vitamin which actually functions in our body. So three forms are there. One is the structure, basic structure of the vitamin, then the active form, that is nicotinamide, and the coenzyme form or the biologically active form. These are NAD plus or NADP plus. Okay, so it is present in two coenzyme forms which functions along with the apoenzyme to form a complete active enzyme. NAD plus, that is nicotinamide adenine dinucleotide. While going through the different reactions of biochemistry, you must have seen that various vitamins they require, not vitamins, various enzymes they require NAD plus, NADP plus. In our previous vitamin, that is vitamin B2, we have seen FMN and FAD, which are also important or required by various enzymes in different pathways. So likewise this vitamin B3, it is present as coenzyme form, that is nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate form. Okay, so the other name of NAD plus is coenzyme 1, and for NADP plus coenzyme 2. So the structure of this is nicotinamide. We have already seen this part is nicotinamide. It consists of a D ribose attached at the N position or the nitrogen of the ring structure, pyridine ring, 2 phosphate group, another D ribose. So this is the structure of NAD plus. Okay, and in D ribose another adenine group is attached. So the complete structure of niacin or active form, it consists of 2 ribose sugar, 2 phosphate group, and adenine group, and a pyridine ring structure, or nicotin, not pyridine, a niacinamide or nicotinamide ring structure. This is NAD plus. In NADP plus, what is there? There is another additional phosphate group which is present at this ribose ring. So in this ribose another phosphate group, if it will be attached, this the complete structure will be NADP plus. Okay, I have written here. So this is the complete structure of the vitamin. No need to go very detail into it. For MBBS student, not required. For PG student, you if you go through the topic 2 or 3 times, it will be automatically get remembered by you. In few exams, like in we have to choose 2 to 3, like in PGI exam we have to choose 2 to 3 more than one correct options. In those exams this type of questions are usually asked, pre PG examinations. Now coming to the synthesis of nicotinamide. Nicotinamide is not found, means the synthesis of this form of the enzyme of the vitamin, nicotinamide is not formed directly from nicotinic acid. Means from this inactive form, this nicotinamide is not formed directly. It is formed by the degradation of NAD plus and NADP plus. So means these two, they are formed in our body from the this structure, this pyridine 3 carboxylic acid, and these undergo degradation to form this active form, that is niacinamide or nicotinamide. So how NAD plus and NADP plus are synthesized, let's see. This is also not very much important for MBBS student. You have to remember very important thing, one thing, that is tryptophan. 60 milligram of tryptophan is required for the synthesis of 1 milligram of niacin. So we can say that it is not complete or not true vitamin, we can say, because our body can synthesize this particular vitamin from another essential amino acid, that is tryptophan. So what happens, this from tryptophan and dietary nicotinic acid, when in our diet, when nicotinic acid is present, they undergo a series of reaction to form NAD plus and NADP plus, and from NAD plus and NADP plus this nicotinamide is formed. So what happens, tryptophan undergoes a series of reaction not shown here completely. It forms quinolinate. Now this dietary nicotinic acid, it forms niacin ribonucleotide. Quinolinate also form niacin ribonucleotide, PRP, phosphoribosyl pyrophosphate. One carbon dioxide is released here. So other name is niacin ribose phosphate or niacin mononucleotide. So means this tryptophan dietary nicotinic acid, they form this structure, particular structure, then form des amido NAD plus, then it forms NAD plus. From NAD plus NADP plus is formed. One thing, that glutamine is required here, it glutamine to glutamic acid, not very much required. Just as I have to made a detailed video to give you every information possible for this particular vitamin, which is available in our different textbooks for both UG and PGs. I have included everything, but I will tell you which part is more important and which you can skip if required. If not, if you are not able to memorize it or grasp it, you can leave that part. These are usually not asked. Now degradation of NAD plus and synthesis or synthesis of nicotinamide. So NAD plus is degraded or nicotinamide is synthesized. NAD plus is NADase, it forms nicotinamide, and D-ribose is formed. Now absorption, mostly the enzyme, the vitamins, they are absorbed in the small intestine. So here also the site of absorption is small intestine. So this is about the synthesis of NAD plus and NADP plus. Now important top point, value of niacin in blood is not altered significantly even in severe niacin deficiency. Hence its determination is of no value in detection in clinical deficiency state. So if you have seen, you might have, some of you might have seen that for few physicians, they prescribe vitamin B complex test, blood test, for if they are suspecting any symptoms or signs in the patient. But in that case, this vitamin is not required. Means this test is not important because we cannot detect the exact level of niacin in our blood. This is of clinical importance. Now coming to excretion, excreted majorly as various products are there by which it is excreted, but mostly it is excreted as N-methyl nicotinamide in urine. Through urine it is excreted as it is a water soluble vitamin. Now coming to sources, first is from essential fatty acid tryptophan. 60 milligram of tryptophan equivalent to 1 milligram of niacin. Limited amount is also synthesized by the intestinal bacteria. Now coming to the dietary sources, animal source, plant source. Animal source, dried yeast liver. Plant source, peanuts are good source. whole cereals pulses. Means this B complex, till now what we have seen, they are mostly present in our cereals, that is rice, the uh, upper bran of rice, like that. So this B complex vitamins, a good source are our cereals, which is a major part of our bulk in our Indian diet. Moderate sources are milk, fish, egg, vegetables. These are the moderate sources. Coming to RDA, 15 to 20 milligram per day for adult, for children slightly less, 10 to 15 milligram per day. Now I would like to show you another thing. These things will be more clear when I will give you a table for this. For vitamin B1 we have seen the unit is milligram, but it was 1 to 1.5. Okay, now for our vitamin B2, here also I told you that the it is milligrams in milligram, present in milligram, and vitamin B1 and B2, they are mostly in the same range, so it will be easy for you to remember. There also 1 to 1.5, here also 1.5, so almost similar. Means if you are asked in Viva, you can easily answer. But for vitamin B3, the unit is milligram, but it has been increased, the amount has been increased, it is 15 to 20 milligrams per day. Okay, so till now I'm just telling you this so that you can compare. All B1, B2, B3 all are present in required in milligrams quantity, but B1 and B2 are same, means one digit, 1 to 1.5 milligram. For special cases you can increase that. And for niacin, that is third vitamin B3, it is 15 to 20 milligram. For children it is slightly less. Usually we have seen that for children the amount increases, but it is slightly less. Another term is niacin equivalent. It is used many times to express the RDA for niacin. 1 Ne or 1 niacin equivalent equals to 1 milligram of niacin or 60 milligram of tryptophan. Coming to the biochemical functions of this vitamin, very important. These coenzymes NAD plus and NADP plus are involved in our oxidation reduction reaction. So this is important part. They are involved in oxidation reduction reactions. What happens in oxidized state? The NAD plus and NADP plus, they are present in this particular state. The nitrogen atom, they have a positive charge over it. They have a positive charge over it, so they are written as NAD plus and NADP plus. But in the reduced state, what happens? This NAD plus, it accepts one hydrogen atom fully, and for the second hydrogen is ionized and only the electron part is accepted, and H plus ion is released into the medium. Just a minute, I will show you. I have written here. So what happens during reduction? Two hydrogen atom, it is broken down, one hydrogen atom complete and one hydrogen is ionized, H plus and E minus. What happens? This hydrogen atom is accepted, NAD plus to NADH is formed. Okay, so one hydrogen is accepted, one electron is accepted, so the positive charge over NAD plus is neutralized with this electron, and one H plus ion is released into the medium. So this is the whole reaction which takes place during reduction. Now coming to the you have to remember this a little bit, because these are usually asked in oral exams. If you can, if you are able to answer very well in your viva, I have not seen questions in theory part for this particular, that write few reactions on NAD plus dependent reaction or NADP plus reactions, NADP plus dependent reactions. I have not seen, but in Viva usually these are asked. To if you score a more above, if you are above average in answering the questions. NAD plus dependent reactions. First, means they take part, this vitamin B3 take part in carbohydrate metabolism, lipid metabolism, protein metabolism, all the metabolic functions they take part. So for carbohydrate metabolism, What are the various reactions? 4 reactions are there where they take part. Glyceraldehyde 3 phosphate dehydrogenase to 1,3 bisphosphoglycerate. Glyceraldehyde 3 phosphate dehydrogenase to 1,3 bisphosphoglycerate seen in glycolysis. Lactate dehydrogenase enzyme for pyruvate to lactate. Pyruvate to acetyl CoA PDH complex. Pyruvate dehydrogenase complex, very important enzyme. Alpha ketoglutarate to succinyl CoA. This is seen in TCA cycle. Alpha ketoglutarate dehydrogenase enzyme. So in these 4 reactions, these are NAD plus dependent. This is the link between glycolysis and TCA cycle. This is in TCA cycle, this is glycolysis. Okay, so these are the important pathways, or these are the important reactions for our carbohydrate metabolism. Now coming to lipid metabolism, beta hydroxy acyl CoA to beta ketoacyl CoA. Second one is beta hydroxybutyrate to acetoacetate alcohol dehydrogenase alcohol to acetaldehyde. See, there is nothing much. I think I can help you how to simplify it. You have to remember it. You can remember one or two enzyme for the particular this in the particular metabolism part, but as this is of TCA cycle, and TCA cycle for biochemistry student is a must to remember. So you can automatically, when you go through the topics again and again, by the end of the year you will be able to recall the this equations or these reactions easily. Now coming to protein metabolism, tyramine to para-hydroxyphenyl acetate, tyramine dehydrogenase enzyme for this reaction. For branched chain amino acid to their corresponding acyl CoA thioesters. Okay, for this reaction is also this NAD plus is required. NADP plus dependent reactions, glucose 6 phosphate to 6 phosphogluconolactone. Malic enzyme malate to pyruvate. Now NAD plus or NADP plus means these two reactions, they may function either in presence of NAD plus or NADP plus. Glutamate to alpha ketoglutarate, isocitrate to oxalosuccinate of TCA cycle. Now NADPH dependent reactions, this is important, this is mostly asked in the exam. NADPH reduction. NADPH is used exclusively for reductive biosynthetic reactions. For reductive biosynthetic reactions it is required. HMG CoA to mevalonate, squalene to squalene oxide, cholesterol to 7 alpha hydroxycholesterol, phenylalanine to tyrosine, folic acid to tetrahydrofolate. So I can show you. These are the different enzymes where this various steps occur, and these are dependent on NADPH. These are asked in the exams. Now coming to deficiency symptoms. The deficiency symptoms is the deficiency symptom related to niacin is known as pellagra. It is an Italian word which means rough skin. So there are 3 Ds for this, and if not treated, it may progress to 4D. The 4th D will be death. So first D is dermatitis. What happens in early stages? There will be bright red erythema, especially in the sun exposed part like ankle, feet, face, neck part, and the increased pigmentation around the neck is known as Cazel's necklace. Means like a necklace, it will be seen a dark band of pigmentation around the neck region. And the dermatitis is precipitated by exposure to sunlight. So the patient will be sensitive to sunlight. Now the second day will be diarrhea. There will be loose stool, mostly associated with blood and mucus. Third D is dementia. Dermatitis, diarrhea, dementia. It occurs in this particular state. Seen in chronic cases means at first early sign will be dermatitis, then there will be diarrhea, and then dementia. Not treated may progress to the fourth D, that is D. Usually seen in chronic cases. The symptoms are not very specific, but that will be like anxiety, irritability, poor memory, insomnia. And the pellagra is mostly seen among the people whose staple diet is corn or maize. The cause is niacin is present in maize, but it is in bound form, hence it is unavailable. And if not treated, it may lead to death, as I have already mentioned. So these are the pellagra may be asked as a short note for UG students. Now other causes of niacin deficiency. Simultaneous deficiency of other B complex vitamin like vitamin B2 and vitamin B6 can contribute to the development of pellagra, as both these vitamins are needed for the synthesis of niacin from tryptophan. When we go to the metabolism, when we will see the metabolism of tryptophan, we will see that in that particular pathway B2 and B6 are needed in the intermediate pathways or in the intermediate reactions. But in that case, in that case, if there is deficiency of these two vitamins, then the synthesis of niacin will not take place, and there will be deficiency of niacin leading to pellagra. It is also seen more commonly in females than males because of the presence of estrogen, and as estrogen metabolites, they inhibit the tryptophan metabolism. So tryptophan niacin formation from tryptophan will be hampered. Now these are usually asked as MCQ, that is association of pellagra in other diseases. Okay, so as we know that this vitamin is also synthesized from tryptophan in our body. So any genetic disorder which affect the tryptophan, that will indirectly will affect the niacin level in our body. First is carcinoid syndrome. Overproduction of 5-hydroxytryptamine occurs in this particular disease. So it may use greater than 60% of the tryptophan, causing deficiency of niacin synthesis. Okay. Now in Hartnup disease, it is a genetic defect in membrane transport mechanism for tryptophan. What is Hartnup disease? It is a genetic defect in membrane transport mechanism resulting in intestinal malabsorption and failure of renal reabsorption mechanism, causing loss of amino acid. Okay. Now previous for vitamin B1 and B2 we have seen there is no therapeutic use, but for niacin new thing we are reading, that is it has some therapeutic uses also. That is 2 to 4 grams per day, not milligrams, 2 to 4 grams per day will be used. To what it does, what it causes in such high dose, it inhibits lipolysis in adipose tissue and decrease circulatory free fatty acid, decrease TAG synthesis in the liver, decrease cholesterol. TAG means it affects the lipid, it maintains our lipid profile level, triglyceride, VLDL, LDL level, hence used in the treatment of hyperlipoproteinemia type 2B. So this is the MCQ part, important for MCQ. This part is also important for MCQ. Two diseases associated with niacin: carcinoid syndrome, Hartnup disease. Therapeutic uses is seen till up till now, whatever we have studied in vitamins. Niacin can be used as a medication in hyperlipoproteinemia type 2B. Now toxicity will also be seen, a very high dose if administered. For this point, the toxicity part we have not seen in our previous two vitamins, that is vitamin B1 and B2, but here toxicity we are seeing. In spite of being a water soluble vitamin, it causes toxicity. Why? What it causes? Transient vasodilation of cutaneous vessels and histamine release associated with itching, burning and tingling. So this is all about our vitamin niacin or vitamin B3. So I will just go through very fast. We have read about synonym structure present in active form niacinamide or nicotinamide, but the functional form is the coenzyme form or biologically active form. So three forms are there here. Synthesis, there is a pathway for synthesis, then absorption, sources, RDA, functions, oxidize and reduction state, oxidation and reduction pathway, NAD plus dependent reaction, carbohydrate, lipids, protein metabolism, NADP plus reaction, NAD plus or NADP plus, either or two reactions, NADP H dependent reactions, which is used in reductive biosynthesis reactions. Very important for Viva. Deficiency 3D may progress to 4D. Other causes of niacin deficiency, association of pellagra with other diseases, therapeutic uses of niacin, toxicity. It's all about niacin. It's more than enough, and I have covered every book. So you don't need to go through any book after reading this particular notes. So if you are having any doubt, do let me know in the comment section. If you want any topic, if you want I should make a video on any topic, do let me know. I will definitely make a video on that particular topic. Thank you. Happy reading.